Hi, I'm Joy with the 𝗣𝗿𝗲𝘀𝗀 line. We have worked with CalHope in the past. We provide peer support over all of California. We do a virtual forum line from 9 in the morning to 10 p.m. That's our website there. Yeah, and one interesting thing that we do that I think has been really successful for us is that for callers that are interested, we can provide a once a week, half an hour check-in with one of our peer counselors as a way to keep them sort of on track and make sure that, it's not just a one and done. We want to make sure that we're with them throughout the amount of time that they actually need support. Yeah, and we do some support groups as well. And we've also historically done some in-person disaster relief as well.
Wow. Thank you, Joy. I actually did not know that. I thought I
Yeah.
knew what the 𝗣𝗿𝗲 line.
No, yeah, it was a minor thing that we ended up doing for Santa Barbara and Santa Clara as a result of some of their floods last year. Yeah, we went
Wow.
in and for 3 months we worked with the communities there to try and provide support and crisis relief.
All right. I'd like to invite Sherrel and Felipe to tell us a little bit about the California Peer Run Warm Line.
Yeah. Hi, everybody. My name is Sherrel. I'm the Associate Director of WarmLine Programs at Mental Health Association of San Francisco. And we currently operate the California Peer Run Warm Line as well as the CalHope Warm Line. The Warm Line has been in existence since 2014, but we've gone through a bunch of different eras. In late 2018, 2019, we were able to secure state funding, and that's where we turned into the California Peer Run Warm Line. And so we are available 24/7, 365. Folks can call, text, use live chat to reach out to us. And similar to, I imagine, a bunch of the other warm lines, if not all the warm lines, we're available for anything and everything. So we try to say that, non-crisis, we're moving away from that just because crisis looks different for everybody. We really want folks to be able to reach out regardless of what they're feeling or what they're going through. And yeah, I think I'll pass it over to Felipe in case there's anything else you want to mention, and introduce yourself, Felipe.
Hello, everyone. My name is Felipe, and I am the WarmLine Program Manager. I've been with the WarmLine since 2021. Started off as a counselor, and have been in various roles throughout the agency and providing different forms of support. But yeah, as Sherrel mentioned, we're open 24/7, 365 days a year, and it's really about that continuum of care, and like everyone. Support looks different for everyone, so we try to incorporate as many trainings as we can, just so our staff has adequate tools necessary to provide support for those that are seeking our services from the warm line.
Thank you, Felipe and Sherrel. Let's see. Why don't we go to Jolissa?
Hi, everybody. My name is Jolissa Hebard. I'm with NAMI Westside LA, and we are currently wrapping up the CalHope warm lines. We do keep these lines open, but as I kind of mentioned before we officially started, the funding around this has changed for us, and so we are not manning these 24 hours a day, 7 days a week. Unfortunately, we would love to have the staff and funding to be able to do that. But I actually am going to put Cynthia on the spot and have her share a little bit about where this program came from and how she started it, because she's the real boots on the ground. So Cynthia, share your history with the CalHope warm line.
Welcome. Hi, everyone. I'm glad to be here because this is such an important issue. I've been manning the phone since CalHope. So that was like, what, 2019, I think, or 17? I don't remember, 2019. And I was a crisis counselor first. And then after that, they asked me to now become the warm line representative. So what that means is that, like, I get on at 7 o'clock in the morning and I retrieve all the phone calls from the night before. And then I call the people. It is a less than 24-hour return with phone calls. So I really try to keep up with all the phone calls. And if there's an emergency, I call that person first. We have that on our warm line. If this is, an emergency, please mark this, that it's urgent. which is really beneficial. So that separates the calls from the regular calls. I have been dealing with a lot of 988, and I've been very frustrated because I'm getting calls from the Valley, Palm Desert, all different areas. And I don't have that resources, but I help every one of them. I Google everything they need to know, and I report back to them. And sometimes we have difficulties with some people. I've had 2 out of my whole last 4 years of very difficult people. So I feel very blessed. And I'm here to help as much as I possibly can, regardless of our classes, you know, or someone in crisis that just needs to talk. I'm here to listen and help them. And I outline it and I write notes, very lengthy notes. So you could go back, which is really wonderful. So you know where I've been and where I'm going and trying to help people. And I'm really lucky to have this position. I feel like I'm really blessed. Thank you. Can we ask questions later, Libby?
Yeah. We certainly can take questions as we go along. I don't see any in the chat at the moment.
The people that were just on Felipe, I'm going to keep that, but I want to know what areas are they 24/7, 365? The California Pier Warm Line.
Yeah, we serve all of California.
Oh my God, that's great. Can I just have all your resources, please? Thank you.
No, that's
really great to know.
Yeah, no, that actually does remind me. I'm sorry, I forgot to mention it when I was introducing myself. But we do have 2 things. So we have a conference coming up next week called Redefining Crazy. It's the system, not the people. So we hold this every couple of years. You're welcome to visit our website at mentalhealthsf.org to learn a little bit more about it. But that segues into another piece that I forgot to mention, which is what we're calling our WarmLine Federation. And so, unfortunately, our director and our associate strategic partnership director wasn't able to be here, but they are operating this WarmLine Federation where we regularly interact with various WarmLines around the country. And kind of building out partnerships and offering technical assistance, and that can look like a variety of different things. So if folks are interested, I'm happy to, if you want to reach out via email, feel free to reach out to me. They'd be happy to talk a little bit more about that and connect you with both of them.
Thank you. I'm sorry. Thank you very much. It's wonderful work that you're doing.
I'm going to try.
And I know we kind of laughed at it. Sorry, Libby. I know we kind of laughed at it, but if there was an actual way for us to have a database of resources that we could access across the state, I feel like that's the other thing, is that what's happening is we're all going and recreating the wheel every time, Google searching, looking for things that are in other areas. Because I know that last year at the NAMI California conference, there was an organization that handles a lot of the 988 calls in Northern California. And one of the things they were saying is that some of the smaller organizations that don't have personnel to staff overnight, when they turn their phones off, those phones just get transferred to whatever organization is still open. So there was an organization that's turning their phones off at 5 p.m. and turning them back on at 8 a.m. So all of those calls were then being transferred to an organization that was outside of the area. And so I feel like that's another issue that's happening, is we maybe don't understand all of the pieces and what everybody's capable of doing. So if you're signed up to do 988, but you can't do 24 hours and you're turning your phones off and then those are going to other areas, we're going to run into these situations where people are calling in from, from outside of our service area, somewhere in San Bernardino or somewhere in, Inyo County, that we're just like, okay, how do we help this person? Because I think everybody on here is like, I'm going to help no matter how it takes. Right. Like no matter what it takes, we're going to help this person, even if it's maybe not the most efficient or not the most expedient use of time. So even though it was a joke, can we put that out there? Can I put that into the world?
Yes, absolutely. Yes.
We can have like a statewide resource database that we all connect to.
Yeah. Or for Los Angeles County, being a county of almost 10 million people, we need a county-wide resource. There's so many resources here that After 30 years in this field, I'm still discovering new things. I do want to get to Candy, though. We haven't heard from her. Candy, please do introduce KingsView WarmLine. Let us know what you're up to.
Hi, everybody. My name is Candy Lopez. I'm supervisor for the Tulare and Kings County WarmLine. We are funded through the county, which is Tulare and Kings. We have been up and running since 2011. Like I said, we started really tiny, only 3 people. And our hours back then were from 8 to 5. Then we ended up going 24 hours. That was really exciting. I came on board in 2016. And since then, we have just grown. 2018, we got our contract with Kings County because they loved our work and how we handled all Tulare callers. We never turn anybody away, even though we are funded through Tulare and Kings County, because I just don't have the heart to tell people like, hey, we're not going to help you. You're not from our county. We do give them, however, resources to their local area if they give us that information and if they want it. If they don't, then we try our best to help them out as much as we can, but we do let them know that we can help them if they're looking for resources within their county. Now, we started off with, like I said, 3. Now we're staffed with 11. And me, that includes 12. So it's grown quite a bit, and I'm really excited. I'm proud to be a part of that. And like I said, I'll be going 8 years now with WarmLine, and I'm very happy to be here, and I'm excited for this. So thank you for having me.
Thank you for coming, Candy. I so appreciate it. A couple of things that I want to just touch on, and I don't know if everybody has to chime in on this, but could anyone give us an explanation for those that don't know of what 988 is? Because I think there's confusion and lack of information about it. Does anyone want to? Cynthia, go ahead.
I think it was a suicide hotline, and then now it's 988, and it's supposed to be a crisis line. I'm sorry, Libby. I've had nothing but really, really negative things happen with the WarmLine of 988. And I have people calling me, reaching out, saying they told me to call you. All right. And I'm willing to help them. We just had a meeting with 𝗣𝗿𝗲𝗀𝗃 about this, and they weren't even clear. We think, if you're having a problem, a medical problem, and you're calling this 988 WarmLine for mental health, it's not really working. They said that we might patch you in, or they might call, but if you're in a crisis and you have your mother, father, someone in a crisis and need the pet team coming out immediately, okay, they won't do it.
So I think that 988, what I want to observe about it is it's a national program. This is an enormous nation. I think it's going to take some time before our systems of care figure out how to make 988 effective. It's, I think, essentially a good idea, but the reality of it is you don't exactly know when you call 988 who you're going to end up talking to. It could end up in a place that's far from you where they don't know the local resources. It's a little bit of a patchwork, and I've heard complaints about 988 too, but I've also heard some compliments of 988 and their ability to rise to an occasion. So, what I hope is that people like us, the boots on the ground, need to continue to give input, to continue to give feedback so that the system can get better. This is also a new role for 𝗣𝗿𝗃𝗀𝗃, I would point out. They've been doing their suicide hotline for many years, but 988 is like a whole nother level. I don't know exactly how many calls they get or how many callers they have, but just the training of everyone and getting everyone on the same page. I think there's some really difficult logistical challenges there, and something that really needs to be we all need to kind of be looking at that. Maybe this is something where the WarmLine Federation can have a voice around this and, help find out from all the WarmLines what's happening with their relationship with 988 and try to make it better so that their appropriate referral is going to the appropriate resource. You know, if someone's having a medical crisis, we need to get the medical care. If someone needs someone to talk to, then a warm line's a great idea. So speaking of that, can anyone explain the difference between a hotline and a warm line? Like, what is the real role of a warm line versus a hotline? Because I think people don't understand that too well either.
So Sherrel,
Okay.
I think the way that we've explored it so far is that, like, at least for our warm line, we really emphasize that we are at least we try to be a preventative service. And so we often use kind of like this boiling pot analogy that, like, when things start to boil over, like, you can call us and we'll try to help you, you know, prevent from reaching that boiling over point. And so trying to be a low threshold, very accessible emotional support service. Whereas a hotline, at least I know things are changing and we're even talking about how, like, 988, it's very unclear. Like, is it a hotline? Is it for crisis? Is it not for crisis? Is it for everything? But I think hotlines, at least historically, have been viewed as, like, once you've reached that boiling point and, like, you need, like, higher level crisis support, whatever that looks like. But even that's evolving. But I feel like that's the way that I've been educated on warm lines, the way that I viewed warm lines, and also warm lines tend to have a lot more peer support, or a lot of more peers, whereas hotlines don't necessarily require peer support or lived experience. But I know that that also varies across the different services.
Yeah, I agree with that. This is Joy again from the 𝗣𝗿𝗲𝘀𝗀 line. But when we were talking about, like, how we want to pitch ourselves as a warm line, we wanted to make very clear that you don't have to be in crisis to call us. You don't have to be in acute crisis. You just need to want to talk to somebody about a thing that you're going through, and we're here for that. I mentioned this a little earlier, but just so it's caught in the main body of this programming, when we tried to put down suggestions of, like, what an individual, like, what our ideal care seeker would look like, right, and encourage people to call if they were, you know, in crisis. We might not, when we tried to filter people out, it was very counterproductive for us. People tended to filter themselves out if we gave any sort of, like, hey, we're best with, you know, acute crisis, or if we're best with not acute crisis. People would tend to self-select in a way that meant that they were not accessing the support. So we wanted to be as broad as possible in terms of people we serve and situations we respond to. So at this point, you know, we'll take anybody. We're happy to have you. We're happy to work with you.
Thank you, Joy. Cynthia?
I think the main thing that we really try to do is encompass de-escalating. When somebody is in such a crisis, they don't know where to call. We have to show compassion and help them and listen to them. With the 988, some of the people are using a different prefix, and it goes to all over the place. It's cuckoo. I don't know what to say. But it should be going to the clearest area that is your area. And that's the problem I have with that. And also, they say that if you're in LA County, they will call. And then they say, no, if you're in LA County, we'll give you the number. So we really need some black and white thinking with 988 and clarity. I think would be really beneficial for all of us.
I think that would be a great service. I think it's probably going to take some time to work out the kinks. I mean, I guess one of the questions in my mind is, as a peer, sometimes we call warm lines as well. I feel that calling a warm line, a peer who has had a difficult day and calls a peer warm line to get support, to me that makes total sense. You know, peers sometimes support people who are in crisis, and that can be really hard. We need to debrief with someone, and being able to talk to someone on a warm line in a confidential way, I think can be really useful. I don't think we have to think of warm lines as just for the people being served. It can be the peer workforce as well. And so I think that's a great resource. So when I was getting ready for this roundtable, I kind of put out the word about what questions might be good. Candy had a great suggestion to take a look at what are some ways that we as supervisors can keep WarmLine staff motivated, supported, happy, feeling valued. What do you think some of those strategies could be? I open that up to everyone on the panel. Go ahead, Candy.
I figured I was like, might as well go first on this one. Well, one of the things before I even knew what peer support was or what a WarmLine was, I didn't know what to do, where to go to. I felt very unsupported. Anytime I asked questions, nobody was there really to help me or assist me, things like that. So I always felt alone, and it wasn't a very good feeling. So once I became part of being their supervisor, I made sure I wanted my staff to never feel that way, never feel, feeling like their supervisor, once it's 5 o'clock, they can't get in touch with me or I'm not there for them, because then that's the kind of thing that makes you just feel so unsupported. Or at least have like a backup system, let them know, hey, if it's a severe emergency, call my personal number if you need it, if it's a severe emergency. If not, if it's something you had a call that was kind of not so much a crisis, but maybe a caller was being negative, being rude, send me an email. I will get to that and I'll respond to you in the morning, just so they know and they felt supported, because I never had got that when I first started. So ever since then, I've kept that in my mindset to make sure I don't let staff feel ever in the darkness. I don't ever want them to not feel that they can never get in touch with me, not feel that they're alone. And if they are, because sometimes we do get calls that are very severe and can just stay with us and stick with us, those I encourage them to give me a call and just vent out themselves, cry it out. And hey, I'll cry out with them. I just have to connect to validate them and value them and let them know that they are so great in what they're doing. And a lot of people don't understand what we do, what we go through, just because we're at home and answering calls. Because I get a lot of people, a lot of negative, like, oh, you get to work from home, it's so easy. But no, they don't understand the mental drainage that we get as, peers that answer these phone calls. Because we get rude, we get inappropriate. Oh my God, do we get lots of inappropriate calls? And, I got staff that just don't know how to handle some of that situation. So I just want to make sure that they're there. Sometimes I have activities. Teams, I will tell you, Microsoft Teams has been a great app for my desktop. I use it with my staff. I created a group chat. So we're always together, always connected. It's gotten us closer as well. I encourage them to share things that they've done as self-care routines on there. I share little clip notes of cute little positivity, little artwork. I just want to make sure that they know that I'm there for them, that we're all connected. We're all there for each other. And like I said, it's gotten us a lot closer with one another. We've trusted a lot. We've trusted each other way more. And I don't feel that there's oh, I'm scared to go talk to my supervisor about this because she's going to get mad or something. I feel like I've gotten that stigma out of that. Instead of, working and getting at them, I'm like, hey, let's try to resolve this together. Let's see what we can do. Let's see what how we could resolve this issue that we're getting with a nuisance caller or just something. We're all working together, and I strive myself really, really hard to make my staff not feel alone or unheard.
Wow. Thank you, Candy. So many great ideas. I like the idea of the having levels of outreach. Like for this kind of stuff might be a phone call. For this might be an email. Thank you for those great ideas. Sherrel, did you want to add something?
Yeah, And thank you, Candy, for breaking all of that down. You sound like an amazing supervisor. So your team is lucky to have you. But yeah, we have talked a lot over the years about how to support our staff, especially since our staff has grown so big so quickly. The WarmLine department is at about 130 staff at this point. Yeah, it's a lot. And we continue to grow. And so I think one thing that we've really tried to build out as we were growing is the way that our team is designed. So like I am an associate director, we have a director, but then we also have the program manager, which is what Felipe is. We have about 5 assistant managers, 25 coordinators, and then the coordinators are the direct supervisors of the counselor staff. And so because we're 24/7, we have 3 different shifts throughout the day. And then we have, a handful of coordinators who work all of those shifts throughout the 7 days a week. And I think each coordinator is assigned to no more than 6 counselors. So each counselor receives biweekly supervision. It's mandatory, even if you don't have a lot to check in about. If you have a call and you need to debrief because it was really challenging or you just want to check in, there's always going to be a coordinator on shift to check in with. We have something called group supervision, which is kind of like our monthly staff meeting with the WarmLine team, but we hold it for the 3 different shifts that we currently have. And so counselors in those shifts can show up and kind of talk about what's going on the WarmLine, challenging callers. It's also an opportunity for continuing education. If we want to talk about like a specific theme or topic that's coming up on the WarmLine. But beyond that, I would say we have something that we call peer consultation, and I'm not sure how it came to be, but essentially we have like a partnership with like a licensed therapist. I'm not sure if that's their official title, but essentially they hold different kind of like process groups a couple times a month for different levels of the staff throughout the agency. And so they can kind of, counselors can go to their time and talk about work-related stuff without like supervisors being present, kind of get to talk with each other about what's going on and have like an unbiased voice in the room. And then I think when it comes to the appreciation side, beyond the general support that we've tried to like build in over the years is we really turn to the staff to ask how they want to be shown appreciation. So like I can think of ways that I would like to show appreciation, but like hearing from them directly, like what do you consider a good form of appreciation outside of the support that we're able to offer? And so we try to hold quarterly appreciation events. And so with our team being remote, a lot of those events are remote. But if we're able to provide like gift cards or like meal credits and then have like a evening where we're all together and just kind of casually hanging out, or if we can provide like performance-based raises, which we try to do regularly, because, finances are a really big issue, especially in California. The cost of living is wild. And so I think those are some of the ways that we've really tried to improve our way of appreciation and trying to keep staff and the morale high, which is just being a 24-hour program. But even if you're not a 24-hour program, this work, as you all know, is so incredibly emotionally difficult as much as it is emotionally rewarding. And so I think, again, it's like how really using their voices to tell us what do they need, what do they want to see. And I think a lot of those things that we've built out are based off of the feedback that we've received over the years.
Wow. Y'all are like an army with 130. Wow. My organization is much smaller. Felipe, did you want to add something?
Yeah, Felipe here. Just wanted to add a little bit more of what Sherrel already said, a lot of things that we do. But additionally, we also started implementing drop-in hours. So during these drop-in hour times, we're encouraging all staff either to show up individually or as a group and just have a conversation with managers, like let us know feedback about policies that we've implemented and how can we adjust those policies, or how can we work with that feedback and create new policies down the line, just so that they feel like their voice is being heard and they feel like they're being part of that process as well to implement new policies. And then furthermore, when I used to have a little bit more capacity, I would individually check in with each counselor, just send them like just a quick message individually to each counselor and be like, hey, I see you. Thank you for all your hard work. Is there anything that I can do additionally? Even now as program manager and a lot of responsibilities, I still, from time to time, I'm not afraid to jump in and take debriefs with counselors just to show them that even though, yes, we are managers, but we're still here for you. We still see all the work that you're doing, and we still know all the support that is needed on the line. Having trivia, like if call volume is low, having little trivia games through Slack. So these are all things that a lot of our on-shift supervisors, or even some of our assistant managers, and even myself, we all really try to utilize to, boost them morale and show their staff that we are there for them.
Wow, beautiful.
It's really nice.
Thank you, California Peer Run Warm Line. We salute you. Jolissa.
Yes, I just wanted to say definitely seconding the idea that making yourself available to your team for whenever they need you is highly important, because it is scary. Some of the calls that we're getting, some of the things that we're handling. And as I say all the time, this is not a do-it-yourself project. So we all need each other, and we need to reach out to each other. So definitely being there, allowing, our organization is very small, very, very small compared to 140. So it's, we wear a lot of different hats. So we're not only answering, warm line and resource navigation calls, but we're providing one-to-one peer support, and we're going out into the field and talking to people and doing these things. So really just allowing for that understanding that you're going to need to debrief with people. We have also created now a support group for our leaders. So we, it's technically called the support group for support group leaders, but it's really any of our programming leaders, because we do wear so many hats, and it is a good place for, especially because within our organization, we have peers and we have family members, and many times those paths don't cross, but within this group, they do. And so you're able to kind of get a bigger breadth of an answer from people. I'm supporting this person. I had this conversation. What do you think about this? And we get different perspectives, not only from our peer supporters, but from the family leaders and some of the family perspectives that come into that and might help, and resources they've heard of, which definitely helps. And then recently, and we just came up with this within the last week, so don't ask how we're going to do it because we haven't decided yet, but we have been talking about kind of like a Friday wins, or like a weekly wins area, or some way to kind of put together, like, these are the things that we were really successful with, or these are the things that really made an impact this week, and having that kind of ongoing kind of conversation, whether it's through like a Jamboard type thing, or whether it's through a Google Doc or something, where, because it is so emotional and because it is so draining sometimes, to be able to go to a place that's like, oh, look, we're winning. Oh, look, here's where we had success. Oh, look, here's where a person said that they couldn't have done it without us, or that we really connected someone to a pet team and it helped them, or something like that, so that we all are sharing in each other's wins. Because a lot of times you maybe feel like, am I helping? Are we making a difference? Are we, connecting people to help, or, and yeah, sometimes we get that answer right then, but sometimes it's like, we don't know. And to have those kind of go back to the team and hear each other's stories, and maybe have a monthly meeting where we kind of pick out the best stories and share those. So we're like, okay, this is why we do these things, and this is why we're here, and supporting each other.
Thank you, Jolissa. Cynthia.
Jolissa, that's wonderful. I'm going to call you.
Call me whenever you want.
I just want you to know, I've gained 20 pounds with this job.
What?
Yes, it's been so, really, because I do give of myself so much. I don't want anyone to suffer so much. I don't know. I'm being honest now, really honest.
Yeah.
And I try to exercise. I try to go to a pool. I try to clear my head. Those are important things. We always have to remember self-care. And we did just start this facilitators, and it has just been wonderful. And we're coming up with more ideas of helping people as well. We might want to go into the geriatric field and help seniors now, which NAMI normally does not do that. So those meetings are really terrific. I am now seeing my own therapist once a month. Okay, That's part of the self-care. It's hard. I get a lot of these calls and I get a lot of people. I'm just the only one that's answering, mainly. Some of the peers answer. Jolissa texts and answers. We do have others, but I get the NAMI warm line. And it's tough. It is really, really tough. And I just got to keep loving myself because I love my work and I love helping other people.
Mm-hmm. It's so much to unpack there. I mean, I see the toll it takes on Cynthia, but also how gratifying it is. It's kind of like both
it's so
at the same time.
You have to juggle that. And that's why your self-care is so important. Exercise, speak to a therapist, someone different. But I'm going to call Jolissa now, though.
Well,
I am too.
Yeah, call me up. You guys all got my number. Well, and I think Cynthia brings up a really good point in the idea of compassion fatigue, and that we all care so much and will give so much. And I feel like this is the exact group to be like, okay, we need to check on each other, because we're probably the ones that are like, we'll handle it, we'll be okay, we'll handle it. And yet, who are we talking to about that? That's really where this group came from, was because when you are the caregiver and you are the person that is the one that's constantly taking care of other people, maybe there's not a place that you feel safe to turn and talk to people about what you're struggling with. And so that's definitely for us to be able to support each other with that care and compassion, because we are the only ones who know what we all go through.
And one other very important fact, I have a son that has mental illness. I have a job that's full of mental illness, and I'm a single mother, okay? So I go to myself, where is your happiness, Cindy? Where's your joy? And you got to remember that. You have to remember it. We are really good people. Not a lot of people can handle what we're doing. So we have to give ourselves self-hugs and talks and compassion.
Self-hugs. Wow. Thank you, Cynthia. Let's see, Joy. Don't mean to keep you hanging there.
No, it's fine. Honestly, I think definitely really inspired by everybody and all of their openness and support. I think Sherrel and Felipe, your organization sounds amazing. We had a very similar structure with 3 different shifts with pods of, 1 lead and 5 counselors, where I think for us, the most important thing was getting that lead right, in terms of the direct supervisor, because they're the ones who really set the team culture. They're the ones that really end up setting, the attitudes of the group and keeping everybody, supported and also accountable.
It's a very important relationship.
We also really pushed, sort of a culture of self-improvement. Like, if you find that you're struggling on a call, please be open with us. Please tell us. That way we can maybe do some additional training or additional role play with you. Make sure that you feel confident when you pick up the phone. We had a lot of open discussions about burnout, just because it is so pervasive in this field. And I think our leads were really incredible this past run that we had. All of their teams had really unique and interesting team cultures that developed over time, because they worked together so well. They were incredibly collaborative. For example, if somebody was on the phone with a care seeker and they wanted resources, but that person was having a really hard time finding the specific resource they wanted, they would post in their team chat, and somebody else who maybe wasn't on a call or just happened to know the resource off the top of the head would reply to that, and it was incredibly collaborative. Similarly, if we had a counselor who had lived experience that was really relevant to a counselor, most of the teams knew who everybody was in their team and was able to transfer that person over to the individual with relevant lived experience. That way we could really capitalize on the diversity of our teams.
Wow.
Yeah, and we found that, the staff feeling like they were doing things, they were contributing to the team culture, they were able to come in and support somebody else on their team, was incredibly helpful. Both helping and being helped has been something that we found really built internal support. I
mean, one of the things that I hear in what Joy is telling us is by thinking about the needs and especially the emotional needs of the team, the organization was able to be more productive, more efficient, and do a better job of serving people. So rather than being a detraction from the work you're doing, actually like created more sense of purpose, better referrals for people, maybe greater job satisfaction. Those are some really good things to be thinking about. So thank you, Joy. Candy, I see your hand up.
I also didn't want to scare you to feel like I never have a break or anything as well, because I'm telling you I am available to my staff whenever they need me. I have just recently started to, with all the changes, like I said, to set boundaries. And that is just really, really, really hard for me to do. But I still make sure and let them know, like if I'm here at my office all day, I tell them, please, I'm really tired. If it's only an emergency, please contact me. And they do, and they respect that, which I feel like I've got that respect, and they take care of me. They ask me if I need anything, and it's just like I said, I think we're all well with one another. But before, what I used to do, I would come to work in my office from like starting from 8 to about 1 o'clock, 2 o'clock, and then I'd just work home the rest of the day. And then that way I'd be available to all my staff. If they needed me at 12, 1 o'clock in the morning, I'd be there, answer any questions that they may need. That way I kind of manage my time as well. So that way they know I'm there and supporting them to my late shift. So it's been rough. I've managed to, it took 8 years to figure out how to do it, but I've done it. And now that's all going to change. So I got to restart again.
Another challenge of our field is that it's very dynamic. And the challenge we rose to last year might be a different one this year. I've certainly experienced that. I
think we've really tried to encourage, like for me, like being able to like let go and hand over responsibility to somebody else has been something that I really struggled with. But you know, I have good people now under me that are able to like be there when I am not. And that has really taken a load off. So I really encourage you, Candy, if you can find somebody who, you know, maybe does the night shift for you and takes those calls and is that supervisor for them, or like even like a counselor that is there that you just are like, this is somebody who has a lot of experience and I trust. Giving them, you know, a little bit of responsibility there as an authority, I think would be.
Well, because we're so tiny, our warm line's so tiny, our shifts are either 1 or 2 people per shift, which is like a 4-hour shift. I don't ever put anybody to do an 8-hour shift because that's just overkill for me. And I didn't want them to feel overworked, overwhelmed, and especially if you're just getting emotional call after emotional call. So usually it's just one person on the shift, and like I tell them, just go ahead and shoot me a message, shoot me an email, but of course call me if needed. So it's or if they have a partner, that shift, they talk to each other, and that's how they get support and help. But sometimes not all the shifts are that busy to have 2 people. So it's they do, like I said, they do great on their own. And then when they only really need help during the evening shift, they will contact me and stuff. But I think we've all been working so well together that we've been able to manage our line pretty great.
Oh, that's awesome.
Well, thank you, Candy. Thank you, Joy.
You're doing so much. I think it's really impressive.
It is. It's a real range here. Really large warm line teams and very small ones. Each with their own different challenges. I see an interesting question in the chat from Ann Gardner. I've had 3 different individuals this week come to the 𝗣𝗿𝗲𝘀𝗀 line looking for employment as peers. Is there opportunities with any organizations that you leaders are aware of? And were they looking for warm line positions or any peer position?
They were looking for peer positions. So I did tell them to contact you, Libby.
Okay.
One of them because they were in your area. One was in Fresno and one was in Mountain View. So, and Joy did just share with me a link for, oh, that's Cat, for employment opportunities. But if anybody else has got some resources, I don't know, just if there was a graduating class of certified peers and they're just reaching out, yeah, please let me know.
You know, my go-to source is Indeed.com. I try to look on there almost every week just to see what's happening in the field and who's hiring and what kind of positions. I will observe that larger urban areas tend to have more opportunity. Right. They just have more agencies and more providers, and they tend to be hiring more frequently. Very often what happens for the peers that I know that live in smaller communities or rural areas, there may not be a lot of providers, and if they're not a good fit for a particular provider, they may not have a lot of other places where they can get hired. So it is a real challenge in some parts of California to find jobs, and it also depends on that person's particular interests and their needs. Some people want to work with a specific population, or they may not have a car. They might only be available at a certain time because they have kids. You know, sometimes there's some limitations there. But yeah, I kind of feel like, I mean, I haven't seen a peer job board specifically that seems that comprehensive. I think there's kind of a need for that. So what I encourage people to do is, if they know of a certain place they really want to work, keep an eye on their careers page, because not every organization has the funds and resources to post all their open positions. So they might not all be posted, and reaching out and saying, well, I'm really interested in working for this organization. Is there something that, you know, can you let me know what's available? But my first go-to is always Indeed.com. So, Cynthia, did you want to add something?
Yeah, I wanted to add that because of CARE Act, they want, like the peers, they want peers to be there with people. So if the phones maybe don't work out, maybe you get a position being a peer with someone that needs mental health. And that Libby knows because she does all the trainings.
Yes, we do.
You know,
we train.
And SAMHSA, I think SAMHSA is a great area to look into. I even had people call me on the warm line, leave me a message that they were working with 988 and they think it would be a better fit to work with NAMI. You know, you never know what one shoe fits and one shoe doesn't fit somebody. Yeah. I think what I wanted to talk about was that there's a lot more intricate problems than it was when I first started the warm line. Are people realizing this?
I don't think
the difficulty that you have helping people.
I mean, you're sort of posing a question to the panel. What kinds of complexities are you encountering as you try and serve people? Anybody want to take that? What are some of the situations that come up that are, you know, have many layers to them?
Yeah, I can speak to that a little bit.
Okay.
Yeah, we started during COVID, so that's when our warm line started. So we kind of came about in chaos, right, where people were separated from their usual support systems and their usual like beneficial habits. It was very challenging for them to do. So we had to really encourage folks and work with people and figure out what they had access to, who they actually had access to, and what kind of support they could build in as a sort of newer COVID-19 conscious support system, or, you know, healthy habit type things. And a lot of them, you know, ended up pivoting to meeting virtually with their friends. You know, so we ended up talking a lot about that kind of complexity of what do you do when your normal go-to things are not accessible for you. And I think we've been able to sort of take that attitude of like, you know, starting from the bottom, figuring out what they have and what they have access to, and then what they need, has really helped us move forward as an organization, even after COVID-19 has they're calmed down. It's less of a crisis now, but still happens. Mm-hmm. And I think what came out of that for us was the continuing care program, which is we'll check in with you regularly, not just one-off when you call, but if you're interested, we'll set up continuing follow-up appointments once a week for 30 minutes. That allows us to keep in touch with care seekers, make sure that they're, hitting their goals, they're talking to somebody, they're doing well, the resources we gave them are working out for them, and if not, continue to work with them to figure out what does work. Just because, in COVID-19, they really needed that contact. And now we found it was a really great way for us to work on those very complicated cases that needed continual support.
Heather, I see your hand is up.
Hi, thank you. So I'm within in the state of Georgia, so we have a peer-to-peer warm line, and what we're noticing is that even though we are a line to handle crisis calls, we often do get some crisis calls, just because peers haven't had the greatest situation or experience with like our 𝗥𝗂𝗀𝗀𝗀 or the 988 system. And so my question for the panel is, do you guys provide your employees who are on a warm line any sort of crisis training? And if so, what does that look like? Because for us right now, we follow the intentional peer support model with that sympathetic listening and everything, but we want to do that warm handoff, but a lot of times we get peers that are very resistant to that warm handoff to a crisis number.
Mm-hmm. That's a really good question. So I guess part of that question is, how do we connect with resources such as Access, PMRT, PET? These are some of the different kinds of emergency responses that we have in California. Does anybody want to talk about that?
I can try to start off. I'm still forming my thought a little bit, but I know in the past year, we've really focused on our program. We don't practice non-consensual active rescue. So we'll never call emergency response services or 911 unless the person says it's okay and that they want it. And again, being originally a non-crisis emotional support line, the reality is we do get a lot of folks who are in crisis. So in our training, while obviously it's all foundational peer support, we kind of follow the mental health recovery movement, those values. I think when it comes to people who maybe call in and have suicidal thoughts and feelings, and maybe they have a plan or they're planning to do it within 24 hours or in the next few days, I think we've really encouraged our staff to utilize those peer counseling skills because our data shows us that it works. So any callers that would be deemed quote unquote imminent risk, we've been able to de-escalate all of those calls without non-consensual intervention. And I think it's because we've encouraged folks to focus on the feelings, not necessarily the content, but also let the caller kind of guide that call. And if possible, if they're interested, we can offer crisis resources, or we can offer, is there a third party that they trust? So is there a friend, a family member, anyone that they would be willing us to connect them with, whether that's connecting through a phone call or waiting until that person shows up? It's all going to look very different, but I think that ultimately has been the most successful way that we've kind of responded to these types of scenarios. And again, I'm still thinking about the different types of scenarios that could come up, but I feel that's something that immediately has come to mind.
Thank you, Sherrel. That's really interesting to hear. Anybody else want to speak to this?
You know what, Libby? Right now, because of CARE Act and Proposition 1,
mm-hmm.
before each county is going to have their own pet team.
Mm-hmm.
Do you realize that? So it's going to be a big change now. There's going to be more numbers to be calling. Mm-hmm. Culver City just got their own mobile access.
Mm.
And right, Libby,
I didn't know that.
Yeah, I thought I sent you. They had a fair, and we went to the fair, and it was wonderful. And it's called MCT, Mobile Crisis Team. The phone number is 310-253-5770. in Culver City.
Mhm.
I know Vista Del Mar has their own pet team, crisis team now as well. So this is coming on. So we all need to be aware of where these calls are going to be going to and who they go to the access line. If I call Vista Del Mar and I have an emergency, Vista Del Mar will call the access line and have them come out too.
Mhm.
The Culver City has their own. So it's all going to change, all of this, with Proposition 1 coming up. And I hope that we get money for all this with all the changes. And I hope people are going to do what they need to do to take care of everyone.
I hope so too. Kat Francis, I know you work also with 𝗣𝗿𝗲𝗀𝗀𝗀, right? Do you want to add your voice here?
I was just asking about Prop 1. I mean, with all the
Yeah.
different things that are going on, I think, one of the things about the altar is that they've done a 𝗣𝗿𝗲𝗀𝗀𝗀 is training. We've done a lot of training early on and continue to do that. But with the funding things already being cut with some of the fundings, what about the allocations now with Prop 1 and a lot of that being transferred back to the behavioral health? How will that help us in MHS, and how do we continue to provide services through WarmLines now that the funding is being reallocated and priorities are being shifted?
I think
What
that's
strategies, sustainability things we have? What do we do
that's
now?
really key to take a look at. I want to make sure before we get to the discussion of Prop 1 that we've given some space to this issue of crisis response, because I think it's kind of central to the work of WarmLines. I mean, obviously, people wouldn't be calling WarmLines unless they were in some kind of distress, and yet, the way we react can impact how, the outcome of those calls. I don't know if anybody else wants to speak to that, or if you do, Candy.
I can speak a bit.
Okay.
So we tend to train our team with the understanding that they are going to get people in acute crisis that are high risk eventually.
Yeah.
We are primarily a warm line, but again, we take everybody. And so we do have callers that are in acute distress. And sometimes we have trained the staff on checks to go through. If they're very, very high risk, we always try to encourage them to self-rescue or distance themselves from, the means, tell a trusted third party. And then if we do end up having to call for in-person intervention, we have a system for that where the counselor will stay on the line with the care seeker while the lead will call the relevant, intervention party. That way, we never lose contact with them. They stay on the line. They're getting support while, emergency services or pet team arrives. We do our best to stay with them through that and check in with them afterwards as well, just to make sure that they're safe and well.
For our warm line, whenever we get a crisis call or any high risk type of call, usually we tend to try to ask questions first before we try to get them the help they need, either connect them to a crisis hotline to where they have a little more training. But usually, to be honest, when we ask these callers that are feeling the way they're feeling, of course, it's a crisis to them. They've already gotten passed through other lines, they gave me your phone number, they gave me this number. So we just try to act, and we're just there to listen to them. We're there to help them say, okay, how did you get to this point? How did you, we just try to ask these questions that maybe nobody else was trying to hear them out. Oh, well, to them, it doesn't feel like they're in a crisis to whoever they called. So we're going to give you this warm line number. Here you go. So how do you feel? How do you think that made that person feel? So what my staff tends to do is we've tried to just let them hear them out. And usually once they get heard, they've actually felt like, hey, someone's actually here listening to me, not carrying me, not just trying to pawn me off to somebody else. That crisis tends to be just, okay, maybe it wasn't a crisis. I just needed a vent, and we allowed them to cry. We try to give them that hug over the phone type of feel. So that way they know that, hey, we are there for them. And usually that helps most of the time, not all the time. When we do get crisis calls and we just can't, there's just no way of helping, what we do is we connect them to crisis, and we stay on the phone with them. Now, sometimes crisis isn't like that. They tell us to, get off the phone, and we're like, well, no, we won't get off until they say it's okay. So kind of that makes crisis, I mean, I'm not trying to be belittle crisis or anything, but it kind of makes them do their work because we're on the phone with them.
It holds them accountable.
Yeah, so that makes them feel better, and they're like, okay, now you can hang up. So that's what we tend to do, and that's how we handle those calls. Luckily, I've always been there whenever one of my staff gets a crisis call like that. It just depends on the right questions to ask the person from our experiences.
So, this is such a rich conversation, but I hesitate to move on. But I do think that Kat's question about Prop 1 is very relevant. She's asked in the chat, how will the passing of Prop 1 impact WarmLines? We know that some WarmLines have already had some budget cuts. Anyone want to speak to this? Do you feel that it may impact your work? Do you think that WarmLines will begin to contract a little bit as the pool of money from Mental Health Services Act is now also serving substance treatment, psychiatric hospitals, and housing in that same pool of money? So I think this is a question that everybody's kind of wondering is, how will it affect peer services in general and specifically WarmLines? Anyone want to speak to that?
Okay.
And you can say, I don't know.
From my understanding with us, which is this is why we're all kind of afraid, is that we are used to being a confidential line completely. Like, you don't have to tell us anything at all. To now that we're getting peer certification, now we're going to be able to medically bill. Now we're going to have to ask those awkward questions that the reason why people like to call us is we didn't ask these questions, and now it's like we have to because it's part of our county requirements.
Yeah.
So that's a change that we're kind of afraid, but I mean, we're obviously going to have to just man up and do it because that's what the county wants. But it's a big change. It's a big shift for us. We don't know what else to expect, and because we have accepted calls from other states, even other counties, things like that, we don't know how that's going to affect this new funding, if we're going to be strict, if we're going to sound meaner, if we're going to, it's kind of nerve-wracking because we just don't know what we're getting into ourselves.
Yeah. Thank you, Candy. Jolissa.
Thanks, Libby. I'm quite concerned about what these changes are going to look like with Prop 1, but then also with some of the Medi-Cal peer support billing situations that was just kind of brought up, because on some of the webinars that I've been on recently, it's like, it looks like they're kind of pushing peer support into medical model because you're looking at, Kaiser and Health Net and Blue Shield as the people that are going to be running the Medi-Cal peer support billing, unless you're a big enough organization to do that. And it's taking some of that out of the hands of these CBOs and peer-run organizations that have kind of built the groundwork for this, which to me is very concerning because how does our voice get caught up in that? How do we stay relevant when these big insurance companies that have been billing, Medi-Cal and have these things that have been going on for a while are now kind of moving into our space and they're not like on the webinars and things that I've been on to try to get grants and try to do things to become someone who can bill Medi-Cal under one of these organizations. It doesn't seem like they're very interested in connecting with our type of organizations, and they are going to look for peers that they're going to hire directly and kind of train in their ways. And that scares me a little bit because nothing about us without us. Like, what is that going to look like? And are we then squeezing out organizations like NAMI and SHARE and then pushing peers into Blue Shield and Kaiser and HealthNet that maybe fit for us? And I don't know if anybody else has been on any of those conversations or kind of heard any of that stuff, but the lift to bill Medi-Cal directly for peer support,
it's a heavy lift. It is.
And if we connect with someone like Blue Shield or Kaiser that is going to still allow us to do our things but bill through them, what's going to happen to our peer support?
And how will it affect that relationship? Thank you, Jolissa. Sean, I see you have your hand up.
Yes, I came into the group a little bit late. So with all the talk of Prop 1, which I know because here in New York, we have our hideous laws too, which detract from the work we are trying to do as peers. But being a white cisgendered gay male with all of one Asian friend, I thought this was going to be a little bit broader of a conversation because we serve a lot of Japanese, Korean, and Chinese people in the neighborhood in New York that I work in. And of course, I use all of my tools as a peer. I listen, and one of the things I often hear from my Asian participants is that there's still a real big stigma within the Asian community about mental health. We are terribly lacking from Asian mental health peers in New York who can actually speak the language. And so I'm curious as to how we can go about us being a white, stupid male who wants to learn more about the culture and be able to be more invested in trying to bring more Asian peers into our world so that, look, as a gay man, I feel much better when I'm talking to a peer who's gay. Because they get it, right? They get my ins and outs. They get what my life is. I can't do that. And I feel like we need more Asian peers, but to do that, we somehow have to break down the stigma. And I just wanted to know any opinions from actual Asian people, and I love the fact you're also women, how we can go about doing that. Or is it just a stupid question?
No, it's a great question. Great question, and one that is being asked across the country, I think. I don't know if anybody here wants to or has some thoughts about how we can invite more Asians to be part of the peer workforce. I think that is really, really important. I mean, I just saw a job listing the other day for someone who speaks Vietnamese for the NAMI Orange County WarmLine, which has a really predominant Vietnamese population in Orange County. And I don't know if there are other thoughts about that from our panelists.
Or how, as a wannabe ally, I can help to, start to dismantle some of the stigma within communities so that people want to come out and be peers.
Yeah, I think, it might be good to reach out to your local Asian organizations. They don't have to be mental health specific, but like any sort of large, like identifying the gatekeepers of the community, like who is it that is, already in there, already connected with the community. Usually they're aware and receptive to the fact that mental health is a challenge, even if it is stigmatized. And they'll be able to point out folks that, already have enough background in mental health to be a peer that you can then kind of onboard from there. I know in San Francisco, there's a really good Chinese-based organization. I'm not able to pull them up right now, but they're awesome and they do a lot of really good work. You know, we end up going to a lot of non-mental health specific events to reach the Asian populations for us. We ended up going to a lot of like Lunar New Year events and things like that. So you'd have, you know,
specific, specific cultural events.
Yeah.
That's a great idea. Thank you.
Yeah, that's super easy, a great way to do it. Plus, you know, you also get to see dragons and eat cool food. So.
True.
Yeah.
That's true.
Yeah, going to local events, even if they're not mental health specific, and just having a booth there and letting people know and being able to like find contacts that way is probably your easiest way into the community.
So folks,
thank you very much.
Thank you for asking that great question, Sean. I mean, I kind of feel like because it's easier to operate a warm line with remote positions, sometimes there might be more possibilities to attract diverse candidates because you aren't necessarily limited to hiring only from a specific geographic region. So maybe it's easier to be more representative, and certainly very needed. I see people struggling. In fact, the next session that's starting here at 2 o'clock is a couple of people who started an organization called 𝗣𝗿𝗀𝘀𝗀𝗃 for Recovery, and their focus is on how do we take a message about mental health to underserved Asian communities. Maybe you want to stay for that one, Sean. J.R. Quote's going to talk.
That's the one I thought I was part of right now.
No, that's
coming up. This group?
No, this is a roundtable on warm lines. So all of our panelists here today are operating warm lines, and so we've been talking about some of the challenges that go with that. And let me share. I have a handout that I want to give everybody before we close.
And I'm really sorry, by the way. Sorry.
No problem. It's actually relevant, though, Sean. So let's see. I really want to share with everybody the contact information of everybody who's been speaking today, in case you may want to add this to your resource lists. And it's been really interesting to find out about some of the different warm lines here. There are actually many more warm lines, some of them serving specific populations. And it's, we've touched on so many issues today, ranging from self-care and staff morale to how we handle difficult calls, how we handle crisis. And I know there's so much more we could do with this, but we do have to wrap it up. And I just want to thank all of our panelists, if we could give them a hand, yay, for showing up today and being part of this conversation. I feel like I've learned a lot. And certainly I feel like I have a better idea of how to make referrals to warm lines from hearing what y'all have been talking about. So I want to invite you to, if you would like a certificate of attendance for being here or to give feedback on this session, I'm putting a link in the chat. If you'd like to fill that out, even if you have filled it out before, you can do it a second time. Just fill in the parts that are relevant to this time. The next session in this room is serving underserved Asian communities through innovative short-term projects. And 𝗣𝗿𝗀𝘀𝗀𝗃 for Recovery has specialized in webinars. They're currently doing a theater program and they have usually people speaking in Asian languages and reaching out to Asian communities. And they have collaborated closely with Asian serving organizations. Joy's observation is a really good one, I think, because Asians typically won't go to an agency that has the word mental health in their name, but they will go to the Asian Youth Center or to Chinese services or something that's more neutral, that's not so stigmatized. I think that's one challenge that the field faces in attracting workforce, as well as the fact that people's parents don't want them to go into this field because it's embarrassing to tell their friends or something. I don't know. There's just a lot of stigma about working in this field in some communities. So I think there's just a need for better education about it and for maybe more culturally competent approaches.
So do you think if we used words like loneliness more as opposed to mental health, that might be like find some different words to use?
Well, I think it's important not to assume that we know. Talking to the communities you're serving, finding out from them what fits for them. Perhaps the concept of stress would be more appealing, or how do I help my kids cope with academic pressure? You know, that's something that a lot of Asian families experience, and they're open to learning more about it